saw a presentation today on hospitalizations, and I'm trying to understand whether you are concerned about capacity issues in Metro Vancouver hospitals linked to COVID, and what should we take out of the fact that we continue to see case numbers soar? Is this going to lead to increased hospitalizations, and are any of these new measures you're putting in place addressing those concerns about potential increase in hospitalization?
Yeah, so the measures that we put in place, to go back to October, November, where we put in place some very strict measures around social gatherings, and I am reminding people that those measures are still in place, and I think we drifted from those. So that is important right now with increased transmission and transmissibility that we're seeing. And the additional measures that we put in place a week ago, and again, focusing on supporting workplaces and trying to reduce transmission in workplaces is part of the ongoing program, yes. What I am, of course, concerned, hospitalization is a lagging indicator. It takes some time before people end up in hospital. Having said that, what we are seeing is that that time is a little bit compressed now. It seems that transmission is happening so rapidly and people are ending up in hospital. So we saw that increase the last week. But yes, we are seeing, so it's a couple of things. Is the proportion of people, the rate of hospitalization going up? That would be more concerning, and we're not seeing that so much. But as the numbers go up, the probability and the numbers of people that will end up in hospital will go up as well, and we are seeing that reflected. One of the things that we do know, though, is that a lot of this transmission is happening in a younger age group, and so the probability of them ending up in hospital is still very low. But because of the numbers going up, the actual, even if it's only, or only 1% of a larger number, or 10%, or what we're seeing, 4% of 1,000 people is much more than 4% of 400 people. So yes, we are watching that very carefully. The other thing that I am hearing from my colleagues in the health authorities, in the hospitals, and we heard that yesterday too, is that people seem to be coming in with other conditions, so non-COVID related, that are at a more severe stage. So I want to remind people, hospitals are safe. Don't stay home if you have a health condition that you need attention for. Go to the emergency department if you need it. Call 911 if you need it. Make sure that you're not waiting too long. And that goes from everything from heart disease, from people who have COPD, people who are waiting because they have concerns about COVID and about COVID in hospitals. So that's also putting a strain on our system. And I know our teams are working very hard to try and balance that. But yes, we are likely to have increased numbers of people in hospital with COVID over the next while. And that's why we all need to, we're playing up. So the things that we do today to prevent that transmission to those people we are closest to will help prevent that hospitalization next week.
And I won't take up any more with this question because we want to get to more questions, but Richard and everyone in the audience will provide some information about utilization rates in both critical care and hospital by health authority, which give you a sense of it. So what it is in Fraser Health and then in other health authorities. I think it's fair to say that the overall utilization rate in critical care, which is in the high 70% range, which is less than usual, but still significant. But the pressure that COVID-19 puts on all our acute care hospitals is real, especially on the staff. In terms of our overall utilization rates, they're, as I say, below what we normally expect this time of year, but that's because of the adjustments we've made. And finally, just say really quickly, Richard, that we did learn a great deal from hospitalization last year and through the COVID-19 pandemic. So we have measures in place should the situation, should the rate of hospitalization continue to increase substantially. So all of those things are in place, but rather than take up time here and list it off, I'll provide that information to you and to others.
Hi, Minister Dix. Don't leave the podium, or maybe Dr. Henry, you might want to answer this question. But I'm going to follow up on something that Richard asked first about some clarity on how overwhelmed our ICU wards are, mainly in the Fraser Health. I understand that Dr. Henry visited some hospitals yesterday, and I'm hearing from frontline workers in Westminster and in Surrey who are scrambling to find space for everyone needing critical care. So could you elaborate on just what kind of support are they getting to try to make sure that everybody who needs care is getting it in these really high-intensity situations?
And I think you're absolutely right, Marcella. Particularly, I had the privilege of talking to the teams at Surrey Memorial Hospital yesterday, where the bulk of the critical care patients and COVID patients are, and where we know the community itself has been most affected by this virus, particularly recently, where rates are the highest they are anywhere in the province in Surrey. And they are doing an amazing job. And yes, it is whelming. I would say they are not overwhelmed, but they are definitely whelmed and tired and concerned. And that's why it is so important for all of us to pay attention, because these are people who have been working on those front lines for over a year now. They know what they're doing. They know how to manage cases, and the way that they are organizing their nursing staff, the way they're organizing the teams to support people who need their care is just, it's world leading. And I'm so proud of especially the critical care teams that have worked together around the province. So we have a strong network of support with those critical care teams. We're learning from each other so that the methods that people are using in one ICU that seem to work are being used in others. They're exchanging information and working together in a way that I think is exemplary. And that is what is keeping people together. It's the fact that they have a team approach, that they are able to manage the surge and support each other. But it is hard right now. And it's something that we're paying attention to. And yes, there is a provincial support to look at where we move people who need certain types of care, whether it's from the north or to the island and interior and the lower mainland. Both for COVID care and for people who need other care. And we are, of course, looking at, do we need to manage some of the other events that are happening, like certain types of surgeries, to slow down on those. And of course, you know, that's something we are hoping never to have to do, because we know the impact that has. But those are the measures that the leadership teams in Surrey, in New West, in Richmond, VGH are doing on a daily basis. So those are things that we are working on together.
As noted, Marcella will provide you with the information by health authority, give you a sense of it. I think what is absolutely true that in some hospitals, the University Hospital, Northern BC and Prince George, at different times there have been real challenges because of the level of COVID-19. There is always at Surrey Memorial Hospital, which needless to say is one of our busiest hospitals. At different times at St. Paul's, there have been real challenges because of both an outbreak there and because of the fact that St. Paul's services the downtown east side, where there had been significant transmission for a period earlier this year. That situation has improved somewhat, as you can see from the weekly numbers. So the fact that it may be 77% in critical care province-wide doesn't mean we don't have individual challenges, and there is a whole system in place to support. That doesn't change the fact that our teams are doing just extraordinary work under high pressure, and this is in addition to all of the other things that they do. So they really need our support, and they have it.